I've been practicing for 25 years. I'm board certified as a orthopedic spinal surgeon, and my practice is limited to spinal surgery. Over the past 3 years, with my teammates, we've developed the concept of Your Spinal Team, which is actually a virtual practice. We are not related in a corporation, but we come together, there are 4 doctors from different practices, in a team approach to try to improve a person's pain. As you know, a sick person or a person that's in pain can't function properly. It's hard for them to work. It's hard for them to get through their day. Many of them can't even sleep at night. And part of our goal in the way we've set up our team is that we strive to relieve our patients' pain. If we can reduce their pain, then many times we can return them to more normal functioning. Hopefully we can return them to work, return them to vigorous sports so they can enjoy their lives, enjoy their families, and participate in all that life has available to them.
Tell me why the concept of Your Spinal Team is the best way to proceed.
Well, in my opinion, many of the operations that are performed work better with 2 surgeons instead of a surgeon and an assistant. And the way our team has developed is that by having at least two experienced surgeons, sometimes we have 3, having at least 2 experienced surgeons, we can almost guarantee our patient that we have a minimum of complications, that we can optimize the operation that's being performed. And that's the crux of the treatment. We don't want to go back. It's not like we're hanging a door or hanging wallpaper where you can say, well, I messed up and I have to go back. We have a very limited amount of time in the operating room with our patient under an anesthetic. So it's time critical and time dependent. And if we can perform that operation to a higher degree of proficiency, then the patients should have a better result. And that's the reason for having at least 2 experienced surgeons at the operating table.
Tell us the difference between having a spinal fusion and having an artificial disc replacement.
Well, a spinal fusion is an operation that was developed almost 100 years ago, first described in 1911. And it was mainly performed for tuberculosis back in the days when they didn't have antibiotics and patients would go on to paralysis and deformity, and spinal fusions were developed. Spinal fusions worked well for that problem, then they were extended for patients that had painful disc injuries. And they are valuable to the patient that is severely disabled. However, because it reduces a patient's motion, it's not a physiologic operation. It takes away part of the normal physiology of the spine. Having a disc that moves, or as in our model, and being able to move the spine back and forth is much more physiologic. It helps a patient get through their day easier, to bend and twist, to get in and out of a chair. In very simple activities that we perform throughout the day, there's a major difference between having a joint that's fused and a joint that's mobile.
How long is the recovery for a fusion versus an artificial disc replacement?
Usually for a fusion, the recovery is between 6 months and 18 months. For a disc replacement, a lumbar disc replacement, or a low back, you're talking probably 3 to 6 months. And for a disc replacement in the neck, 2 weeks to 3 months.
What's the average time for the artificial disc replacement surgery?
We usually tell patients about an hour per level.
And fusion?
2 hours or more per level.
And Doc, where are you practicing out of right now?
I've recently moved my practice to the Catholic Health System, and I've been working at Sisters Hospital. It's a wonderful hospital, a very busy community hospital with a lot of doctors, and they have excellent surgical services, excellent nursing care, and they're very responsive to patient needs. We are the national leader in total disc replacement. We primarily use a product from Synthes Corporation that's FDA approved. We've had truly superb results with our prostheses. many of our patients back to work, back to vigorous activities, hunting, fishing, playing golf. One of my patients actually carries a photocopy of his x-ray in his pocket when he goes to the golf course because people don't believe that he's had disc replacements in his spine. I've had other patients that are back heavy-duty labor using a jackhammer or on the backhoe or bulldozer at 6 to 8 weeks after surgery. So it's truly a large advancement in our knowledge in our treatment of spinal injuries.